Now, the Ministry of Health is set to begin another round of mass vaccination across the country following a low uptake of the COVID-19 jab. So far, only 20% of Kenyans have been vaccinated against a 50% target, something that Health Cabinet Secretary Kagwe says is alarming. Yet the country now has in stock at least 20 million doses. And as Emily Chebet reports, Kagwe is urging Kenyans to take the exercise seriously as more COVID-19 variants continue to emerge.
The Ministry of Health indicating that over 90% of the latest COVID-19 related deaths, as well as 99% of those in ICU, are people who are not vaccinated. The figures showing that only 20% of Kenyans have received the jab against a 50% target, despite the country having in store more than 20 million doses of the various vaccines ranging from AstraZeneca, Moderna, Pfizer and Johnson & Johnson. The low vaccine uptake sending warning bells. And now, CS Health Kagwe says they will once again roll out another mass vaccination drive starting this week.
Vaccinate about 20% of our people, but that's not enough. It is actually dangerous to be at that point. So, effective Thursday this week, we will be launching a mass vaccination campaign. There are measures that we announced last year that we have been relaxing because we understand that not everybody has had the opportunity to be vaccinated. But we have got over 20 million doses of vaccines that are waiting to be used now in the country. And because we are ready and we have got enough vaccines, we will now go more intensively to vaccinate our people in readiness for whatever else is coming.
But more alarming is the emergence of the new variants. A new Omicron subvariant was confirmed in Denmark, and according to the Danish study, the Omicron BA2 subvariant is more contagious and better at evading vaccines than any COVID strain. Although scientists say there is no evidence that it causes severe disease, there are those who opine that those vaccinated can tolerate it more than those who are not vaccinated. A reason CS Kagwe says Kenyans should take personal responsibility in readiness for more variants.
We expect that there will be other variants that are going to come. We have all seen the trend today and our eyes are at it. Every time we relax, you have seen it for yourselves. Every time we think that this is the end of it, we hear something has come out from some Bundu country somewhere, that nobody expected. And then suddenly we have got a whole wave hitting at us. We don't know where the next wave is going to come from.
In Kajiado County, government officers who have not been vaccinated have been warned that soon they will not offer services to the general public. According to the County Commissioner Joshua Nkanatha, vaccine uptake in the county is very low. He has since directed security teams to assist in mobile and door-to-door vaccination in markets, homes and shopping centres.
As a county, each one of us is vaccinated, though it is not mandatory. We are not going to allow an officer to continue giving services to people when he is not vaccinated. He is posing a danger even to people that they are serving.
In the last 24 hours, 171 people have tested positive for COVID-19 from a sample size of 6,134, a positivity rate of 2.8%. So far, 321,552 people have tested positive for COVID-19 cumulatively. Sadly, 4 people have succumbed to the disease, pushing the cumulative fatalities to 5,587. On the vaccine front, 12,451,246 vaccines have been administered in the country. Of these, 6,583,334 are partially vaccinated, with 5,634,410 Kenyans being fully vaccinated, which is 20.7% of the population. Emily Chebet, Citizen TV.